here on The Source. Of course you do.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 20 minutes after 11 o'clock. I don't understand cancer at all. You think you do. You see illustrations and you see that big tentacled-looking cartoon that's supposed to explain it. And I had some skin cancer removed from my nose, and the doctor kind of drew a little illustration of what it was like. And I thought, oh, gee, that doesn't look too good. And thank goodness he took it off, and it was done. It was done with that little thing. And when it's in the blood, though, it's like that's even harder to get my head around. I don't know. Is there a tumor? I don't even know. There's a documentary called Cancer, the Emperor of All Maladies, based on the Pulitzer Prize-winning book by Dr. Siddhartha Mukherjee, hope I'm saying that right, titled The Emperor of All Maladies, a biography of cancer. Dr. Louis J. DeGennaro is on the phone. He's the president and CEO of the Leukemia and Lymphoma Society. He's on the phone to talk to us about I guess it's about the documentary and about cancer in general. Good morning, doctor.
Good morning. Very happy to be here.
How are you?
I'm very well, thank you. How about you?
Pretty good. Where are you? Where are you calling from?
I'm calling from White Plains, New York, about 30 minutes north of Manhattan, and I envy you your weather. It's cold and dreary here today.
That's what I heard. We were just on the phone with somebody in Connecticut and said it snowed this morning. So,
yep, sure did.
Oh, wow. So, cancer of the blood, is that what lymphoma is? Is that something? Am I right? What is it?
Society. Yeah, you're exactly right. The leukemia, lymphoma, multiple myeloma, these are cancers of the blood. They develop in the blood system, and they're sometimes referred to as liquid tumors instead of solid tumors. You said something at the opening that I think is really important. It's hard to understand cancer.
Yeah.
And documentary, this Ken Burns documentary, it was created to help answer that question. Dr. Siddhartha Mukherjee, who wrote the book The Emperor of All Maladies, a biography of cancer, he did it to answer that question. What is cancer? What are we dealing with here? The book and the documentary is a wonderful description of the history of cancer, all the way back to ancient Egypt, when we can see it in mummies found in pyramids, all the way through to today. And I think even more importantly, this documentary, done as only Ken Burns can do a documentary, this documentary highlights the work of the scientists and the physicians who are carrying out research at the front lines today to develop the new therapies that are available to treat cancer.
And do any of the remedies we have today resemble remedies that might have been around during ancient times?
Well, that's an interesting question. No one's ever asked me that before. And I think the answer is yes. In some cases, especially with solid tumors, obviously we tend to treat those initially with surgery, and surgery's been around for a very long time. In the blood cancers actually pioneered chemotherapy. Chemotherapy began, it was the work of a physician named Sidney Farber working in Boston. He used a primitive chemotherapy to begin to treat children with leukemia. So the sophisticated chemotherapy we have today is born from his work. And I can tell you, because of funding from the Leukemia and Lymphoma Society, we've taken childhood leukemia survival rates from 3% in the 1960s up to over 90% today.
Oh, really?
Tremendous progress.
So does the documentary help us, the layperson, know what cancer is, and does it help us in any way? Like, by knowing better what it is, does it help us understand better how to treat it?
I think it does. It's a very it's presented in a very understandable way through the stories of patients. Dr. Mukherjee has a facility for taking complicated science and talking about it in a way that anyone can understand. I think you'll come away from the documentary understanding the disease and the complexity of it much better. But I also think you come away with a very positive feeling about the progress that we've made in research and how we're going to succeed in the not-too-distant future in treating these diseases in a much more robust way. I mean, I can tell you there are many instances. The chemotherapy story with children is highlighted in the documentary. So is the work of an LLS-funded investigator, Brian Drucker, who discovered a drug that treats leukemia. It treats chronic myeloid leukemia, and it targets the cancer but leaves the good cells of the body alone, allowing patients to forego completely the sledgehammer that is chemotherapy. And most recently, just last year alone, a breakthrough that was heralded as the scientific breakthrough of the year called immunotherapy, pioneered again in the blood cancers.
Oh, really?
Using the patient's own immune system to find and attack and eliminate the cancer.
Can I ask a question about tumors? Are tumors caused by cancer, or are tumors breeding grounds for cancer, and caused by something else?
It's basically one and the same thing. Cancer occurs when cells in the body grow out of control. If they're in an organ like the lung or the liver, they grow as a solid tumor, a solid mass that you would call a tumor.
Right.
If they're in the blood, they're circulating around the blood. That's a leukemia. Leukemia circulates around the bloodstream. Lymphomas are found in the lymph nodes.
So in the physical, the solid ones, there's the benign tumor and there's the malignant tumor. Does that same two different types of tumors happen in the liquid form?
Yeah, in the blood cancers, in leukemias, lymphomas, and multiple myeloma, there are forms of the disease that are the term that's used is indolent. It means they're very slow growing, and some that are very aggressive. The acute leukemias, for example, are very aggressive. We have both kinds in blood cancer also.
So a benign tumor is not cancerous by definition, but is there cancer in there somehow in some, I don't know, sleeping state or something?
Yeah, so it's slow growing. It's not malignant. It's slow growing and is less dangerous, if you will, than a malignant tumor or an acute leukemia or a fast growing cancer.
Wow.
When a person is diagnosed with leukemia, is it always fatal, or is there hope of survival to old age if they're young?
No. It's far from always fatal. We've made tremendous progress. The Leukemia and Lymphoma Society, over its 65-year history, has deployed now over $1 billion in research funding, and we've touched virtually every therapy. We've helped to create virtually every therapy that's currently used to treat the blood cancers. Survival rates have doubled, tripled, even quadrupled for some of these diseases. I mentioned childhood leukemia survival rates have gone from 3% to 90%, and we're making that kind of progress with adults as well.
Wow.
Well, it's a topic that's too big for us to really get on a grip on in a little interview. The documentary, how do we see that?
The documentary begins to air this evening, the 30th of March at 9 p.m. It's a 3-part documentary. It'll be on tomorrow and April 1st as well. Comes on at 9 p.m. If your listeners would like to get a sneak preview, they can go to our website, lls.org.
Okay. Dr. Louis J. DeGennaro, I hope I'm saying your name correctly. I apologize if I'm not. Thank you so much for being on the air with us today.
You're very welcome. Have a good day.
Thank you. We'll be right back.
Being in treatment of a psychotherapist because of is documented as being suicidal.
Prosecutor Christopher Goomba Lubitz deliberately crashed the plane, killing 150. A deadly overnight crash involving a church van in southwest Florida. Highway Patrolman Greg Bueno.
We received the initial call approximately 12:31 a.m. this morning. It does involve 8 confirmed fatalities at this time.
10 people were also hurt. The van crashed in a ditch after going through a stop sign and crossing a highway. At Fort Meade, Maryland, there are reports someone tried to ram a gate at the huge Army installation there with a vehicle. 1 person dead. Fox News. We report, you decide.
Geico presents Fan Mail to a Pig.
Dear Maxwell, I just want to say thank you for making my Geico Insurance ID card digital. It's easy to find on the app. It doesn't give me paper cuts, and I always have it on hand because it's on my phone. Because of this, I finally cleaned out my glove box, which was filled with years of paper ID cards. Any thought on what I should put in my glove box now? Sincerely, Trent Patterson. Trent, what can you put in the glove box? Here's a crazy thought. How about gloves?
Digital insurance ID cards, just a tap away on the Geico app.
That's not a lawnmower. That's a zero-turning, fescue-slaughtering chariot of lawn domination, cup holder included. And like all respected machines, it requires a battery, which are now as low as $21.99 with exchange at Napa. That's $21.99 for a lawn and garden battery, and the satisfaction of knowing the weekend warrior rides again.